堆东西还要再做。
So I still remember that was a day or a few days before Chinese New Year Eve. So my phone was keep on ringing and messages, like 1 minute had 100 messages coming in. The airport would call us, the private hospital would call us. So you can imagine that we can't even sleep. At 1 a.m. there will be somebody calling us, at 2 a.m. there will be somebody calling us, at 3 a.m. Okay, so that's the beginning of our huge pandemic wave in Malaysia.
"市民不要离开武汉，离汉通道暂时关闭。"
We're suspending the entry of foreign nationals from entering the United States. Today I am officially declaring a national emergency.
Bagi memulihkan keadaan secepat mungkin, kerajaan memutuskan untuk melaksanakan perintah kawalan pergerakan.
Kita berperang sekarang ni. Peperangan ni kita tak kenal musuh. Frontliners atau Kementerian Kesihatan pun ada kelesuan dah.
Cabaran yang paling besar yang dihadapi adalah memastikan penularan COVID tidak berlaku di dalam hospital.
For all these trainees that come into training, our first question is always this. Do you know that when the fire starts, you are the first one to go into the fire first? In fact, whenever you can ask us not to sleep the whole night to do this, also we are willing to do it. Because I think this is a duty call, okay? We do this because this is what we are trained for. So this is what we want to do also as well.
On December 31st, 2019, the pandemic prevention measure was launched in Wuhan, China. The rapid spread of the pandemic triggered an unprecedented lockdown measure operation in China's history. Entering 2020, in just 1 month, the pandemic has spread to the Asia-Pacific region, North America, and Europe. Confirmed cases have been found in more than 10 countries and regions, including Malaysia. The new coronavirus, COVID-19, is subtle, invisible, and intangible. A tiny virus can bring the entire world to a standstill. It has caused the largest global quarantine operation in modern times.
Pandemic is not a word to use lightly or carelessly. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. This is the first pandemic caused by a coronavirus. We have rung the alarm bell loud and clear.
As of mid-February 2021, the cumulative number of confirmed cases worldwide has exceeded 100 million, and the number of deaths has exceeded 2 million. According to the first indicator survey report released by the World Health Organization, since the outbreak of the new pandemic, key medical services in 90% of countries around the world have been affected. Even the most powerful medical system will have difficulties in facing the pandemic. Turn back to a year ago, on January 25th, 2020. Malaysia's first confirmed case appeared.
All those that have been proven positive, and all are non-nationals. They are all from Wuhan, China, and they are now in our facilities in Sungai Buloh. Kita will intensify all level of preparedness, our CPRCs, and all our PKDs. We are on high alert.
Until January 30th, the cumulative 8 confirmed cases were all travelers from China. On February 4th, the first local transmission case was detected.
Pesakit merupakan seorang lelaki warga negara Malaysia.
The pandemic continues to heat up, and Malaysia has specifically locked hospitals for unified observation, treatment, or isolation of suspected or confirmed cases of the new coronavirus. Penang General Hospital, with a history of more than 100 years, has been identified as one of the designated hospitals by the Ministry of Health.
Hospital Pulau Pinang adalah satu-satunya hospital hybrid COVID di negeri Pulau Pinang untuk merawat pesakit COVID di samping menjaga pesakit-pesakit bukan COVID yang lain. Hospital Pulau Pinang merupakan hospital terbesar di negeri Pulau Pinang dan menyediakan pelbagai perkhidmatan secara tersyari kepada penduduk bukan sahaja di negeri Pulau Pinang tetapi juga di zon utara ini. Dan di hospital ini mempunyai 1,158 buah katil dan 4,800 anggota perubatan. Di hospital ini kita mempunyai 5 orang pakar penyakit berjangkit yang berpengalaman dalam menangani penyakit respiratory seperti MERS-CoV dan juga H1N1 pada masa yang lepas.
我有2个字哦，就是一个就是 infection control， 一个是 infectious disease。看似乎是一样，其实是不一样。infection control 是比较mainly不是在treat病人，而是在 make sure environmental cleaning， 然后staff 的 safety， 然后不要在 hospital 里面有疫情的爆发。
那 infectious disease 呢
？infectious disease 是治病人。
哦。
The infectious disease specialist and consultant doctor from Penang General Hospital, Chow Ting So, has been fighting on the front line from the very beginning.
这个就是传染病我的 infectious disease。
My name is Dr. Chow Ting So. I am actually an infectious disease consultant and physician posted to Penang State. And I still remember that in the early phase, they said that this novel coronavirus has no sustained human-to-human spread. But we all prepare for the worst scenario. So when at around Chinese New Year, suddenly the cases became very, very high in Wuhan and they went into lockdown. China has called for border closure, and we do have reported that a lot of travelers are actually from China at that time.
On the eve of the Lunar New Year, a phone call made the reunion dinner between Chow Ting So and family loses its very meaning of reunion.
That was a day or a few days before Chinese New Year Eve. And this was a very special year for me because all my family members were on the dining table talking and chit-chatting. I was alone handling handphone from morning till night without a rest. So my phone was keep on ringing and messages, like 1 minute had 100 messages coming in because we need to coordinate. And that was holiday time. I still remember I planned to take leave on the 3rd day Chinese New Year. That was a Monday. But I cancelled it because all of us have to come back. At that time, because the cases that come in is not many. So we handled by one single department only, that is internal medicine department at that time. But when the cases became more and more, it's time to call for help. So I gave a call to our director of the hospital and get her approval that we need to involve other departments to give us more medical officers for training to prepare for the bigger outbreak.
Kita banyak perlu mengadakan latihan dan juga penyampaian maklumat yang berkesan kepada semua peringkat anggota yang berada di dalam hospital ini. Tidak kira sebagai frontliner yang menghadapi wabak COVID atau sebagai kepada kumpulan-kumpulan sokongan yang menjadi backliner juga bagi memastikan perkhidmatan dilakukan. Penyampaian maklumat yang berkesan pastinya akan memastikan SOP yang telah digariskan dapat dimanfaatkan dengan sepenuhnya.
So if it's like IVITs and UVITs, you use it. Not anti-COVID. But this one is 1990s, right?
As a senior consultant specialist in infectious diseases, she took the lead, full skill deployed and mobilized, just to ensure that the Penang General Hospital work hard as the front line of pandemic prevention.
So all this will take a lot of effort and coordinating. It's not so easy that now I'm saying it sounded very easy, but I can guarantee it's a huge task to coordinate a staff of 3,000 over, all right? Certain departments are familiar with personal protective equipment, not every department. So we need a lot of effort to get the names because we know our training capacity. We can't train 100 or 200 because we need to hands-on, we need to have a smaller group training, and then we will teach them how to wear the personal protective equipment and making sure that they do not fumble, especially if they're doffing not appropriately, then disaster is actually cannot be avoided. A local outbreak of healthcare workers having COVID will be true. Alright?
Namun begitu, menangani virus yang baru merupakan cabaran baru kerana kita tidak pernah mengenali novel coronavirus ini. Beberapa mesyuarat telah diadakan di peringkat hospital, Jabatan Kesihatan Negeri dan Kementerian Kesihatan Malaysia untuk menyediakan garis-garis panduan dan juga SOP baru dalam menangani penyakit yang baru ini.
You can imagine that this disease is very new, and today if I teach you about the treatment plan, tomorrow it will change. So every week I will have one session on online webinar. We have ICU doctors giving us input. Also, I invited laboratory people. I invited public health people. So they are all on webinar. Without this group of doctors, without a lot of effort from all of us, I think patient might miss the boat to get better treatment.
So you said you need to have buffer PCR, correct? And a fresh swab. Or negative, positive, these are all considered positive. Any PCR, the case will be called as positive case. Okay?
In Malaysia, there are only a handful of infectious disease doctors. There are currently fewer than 60 in the country. In this tough battle against the pandemic, Dr. Chow Ting So becomes indispensable.
ID consultant or infectious disease consultant in the Penang States is handling the whole Penang States. It's not only Penang Hospital. The airport will call us, the clinic kesihatan will call us, the private doctors will call us, the private hospital will call us. So our numbers are published everywhere, okay? So you can imagine that we can't even sleep. At night, at 1 a.m. there will be somebody calling us, at 2 a.m. there will be somebody calling us at 3 a.m. That is the beginning phase when we are on our own and only travelers are affected.
The first wave of outbreaks in Malaysia has accumulated 22 confirmed cases. Beginning on February 16th, there have been no new cases for 11 days.
So at the early March, that was the news from Brunei. Brunei had 2 COVID confirmed positive patients, and these patients just returned from the tablik Sri Petaling meeting. So that sparks the beginning of our huge pandemic wave in Malaysia.
Perhimpunan tablik ni mereka pulang ke kampung dan mukim masing-masing pada 1 Mac dan saya dimaklum pada 9 malam 9 Mac. Jadi tindakan kita 10 hari lewat. Iaitu yang kes tu dah merebak ke semua kampung dan mukim.
So the Brunei government Ministry of Health informed our Ministry of Health saying that we need to track down these 1,000 over participants in the Sri Petaling public gathering at that time. We knew we are going to see more and more cases. So our plan is evacuate. So we started to evacuate our wards at that time.
Penang was unaffected by the first wave of the pandemic, belonging to the green zone. And the first confirmed patient appeared in early March 2020.
Good morning, I'm Dr. Selvin, MO in charge of COVID screening today. We have one patient complain of cough SOB for 2 days, has a history of travelling to the public gathering in Sri Petaling.
So we received our first patient on 6th of March. At that time, we still use only 1 ward. But very soon, less than 2 weeks, we have 10 to 20 admissions per day from the public gathering group. So because they tracked down those people who had travelled and all of them were screened, and once positive, they were actually all admitted. So you can imagine that you have patient admitted and they will not be discharged until 14 days later. So the next day another 10 come in, the next day another 10 come in. So I think on the height of admission and total patient in ward, we have about 85. So each ward we can cater about 22. So we have opened all 4 wards up.
5X. Alright, face you. Okay, glove.
Okay.
Okay, turn around.
At the beginning of the pandemic, the hospital's protective equipment was very limited. The insufficiency of pandemic prevention materials was the greatest anxiety among medical staff.
Penggunaan PPE itu juga telah meningkat daripada 2 hingga 10 kali ganda berbanding dengan keadaan normal. Setakat ni untuk bertahan PPE kita ada sekurang-kurangnya 2 minggu kita boleh bertahan.
Salah satu cabaran yang paling besar yang dihadapi adalah kekurangan PPE yang merupakan satu masalah yang berbentuk global di mana terdapat peningkatan yang begitu ketara dalam penggunaan PPE di selata dunia. Pada satu ketika itu, kita hanya mempunyai PPE yang boleh bertahan selama 5 hari sahaja. Anggota hospital telah mengambil inisiatif untuk membuat PPE sendiri secara DIY dan kita mendapat respon yang sebegitu baik daripada NGO dan juga orang tempatan, syarikat-syarikat swasta yang telah memberikan sumbangan dalam bentuk PPE dengan banyaknya kepada hospital sehingga ini bukan lagi satu masalah.
How to strictly prevent the contamination and minimize the impact and risk of hospital operations is a real challenge for the hospital to come up with the best strategy.
In every COVID hospital and also what we call a hybrid COVID hospital like Hospital Pulau Pinang, where we take care of COVID-19 patient and also non-COVID-19 patient, we have a dedicated COVID theatre for the COVID-19 patient. But we keep our non-COVID-19 patients safe in other theatres by sheet stack to not allow airflow from the 2 areas.
Perawatan kepada pesakit-pesakit bukan COVID masih perlu diteruskan. Kes-kes seperti sakit jantung, kelahiran bayi dan sebagainya. Penjarakan sosial dan langkah kawalan infeksi perlu diteruskan untuk memastikan penularan wabak COVID tidak berlaku di dalam hospital dan hospital merupakan tempat yang selamat juga untuk mereka. Kita telah menyediakan kaunter-kaunter pandu lalu untuk mengambil ubat di tapak parking hospital dan kita juga menyediakan konsultasi secara klinik visual di beberapa klinik yang terpilih dan kita juga dibantu oleh klinik-klinik kesihatan untuk memberi konsultasi kepada pesakit secara pesakit luar.
So if you are to follow me, the patient will come in from the other door and the patient will be in what we call an isopod, right? And the patient will be brought in here inside the OT.
There can be no mistakes in every aspect of the pandemic prevention work. Dr. Chow Ting So must ensure that strict preventive measure is taken.
Every night we need to do census. Every night we have to stay up until 12 midnight and then looking at patient progress and then calling up the doctors. Okay, how is patient A? How is patient B? So you can imagine that every night I slept around 2-3 a.m. and then the next morning I have to wake up at 7 and come to work. In fact, whenever you can ask us not to sleep the whole night to do this, also we are willing to do it. This is the stress level that we have to go through, and the higher position you are, the more responsibility you have. And I think this is a very, very new experience for me. No matter how hard it is, you know, it really, really pushed me through because I choose it and this is like a duty roll call. Whatever outbreak occur, people are running away from it, you are the one that going forward.
Situasi semasa wabak ini memerlukan tindakan drastik diambil bagi memulihkan keadaan secepat mungkin. Dan untuk itu kerajaan memutuskan untuk melaksanakan perintah kawalan pergerakan di seluruh negara.
So we look into the cases, the latest based on the number of cases as well as the 14 days period. Green zone, 0 cases.
Saya merasa sangat bangga dan terharu di atas komitmen yang ditunjukkan oleh semua anggota yang bekerja di dalam hospital ini. Di kesempatan ini, saya ingin merakamkan setinggi-tinggi penghargaan dan terima kasih sekali lagi kepada semua pihak yang terlibat secara langsung dan tidak langsung dalam kita menangani wabak COVID ini.
Pada 26 September, iaitu pada hari mengundi, kes kumulatif COVID-19 di Sabah telah meningkat kepada 1,547 kes, iaitu peningkatan sebanyak 91.5%.
This one was really different. The scale was not what we had expected. This pandemic is a hospital response, but of course the emergency department is usually the first to respond because the patients will start coming to us first. We have to mount the response so that we can protect the rest of the hospital.
Pada masa tersebut memang anggota yang sedia ada tidak mampu untuk menampung dengan jumlah saringan yang banyak. Semua staf, semua anggota tidak boleh bercuti. Anggota-anggota semua dalam keadaan yang sangat stres.
There was a lot of things running through my mind, whether I am fully protected, whether I am doing the swab procedure correctly, and also the scare that I had when the first patient I swabbed actually sneezed when I was trying to take the swab.
Okay, everyone ready? Let's go.
In fact, we are just a normal people, a normal person, but we are also doing all we can to fight this pandemic.
It has been a very tiring time, a very challenging time.